Hello, my name is Emilita Owens. I'm an LPN to BSN student, and I am going to be doing a comprehensive assessment. This is Mrs. T, and she has granted permission to be filmed for this video. Knock, knock. Hello, Mrs. T. My name is Emily. I'm going to be your nurse today. Would it be okay if I did a head-to-toe assessment on you?
Yes.
Okay. I'm going to close the curtains for privacy, wash my hands. I'm going to start off by asking you some questions. Can you tell me your full name?
Miss T.
Can you tell me your date of birth?
010101.
Okay. Can you tell me the month and year?
November 2023.
Can you tell me who the president is?
Joe Biden.
Can you tell me the current location that we're at?
Pocasset, Oklahoma.
Okay. Next I'm going to have you read my badge.
Emilita O.
Okay. I would document that the patient's hearing is adequate. She's able to answer my questions appropriately. She's hearing them. Her vision is adequate. She was able to read my badge. She is awake, alert, and oriented to person, place, and time. Next, I'm going to be getting your vital signs. I'm going to start with your blood pressure. Your blood pressure is 128/82. Are you experiencing any pain right now?
No.
Okay. I'm going to place this on your finger and get your temperature while that reads. It is 97.3. Your heart rate is 82 and your oxygen level is 98. Next I'm going to be shining this light into your eyes. I'm going to do it 2 times in both eyes, and I'm going to have you look at my nose while I do it. Okay, great. Eyes are round and reactive, Perella. I am going to look in your ears. Okay, and I'm going to look in your nose. Okay, and then can you open your mouth for me? Okay, no excessive drainage noted in the ears or nose, and mucous membranes are pink and moist. Next, I'm going to look at your head, check for anything abnormal. No abnormalities found. I'm going to take a look at your throat. Trachea is noted midline and no DVD noted on either side. Next, I am going to listen to your heart. I would normally go under the gown, but for the purpose of this video, I am going to stay above her clothing. While listening to her heart, I'm also going to check her radial pulse. S1 and S2 noted, no abnormal heart sounds noted. The next thing I'm going to do is take a listen to your lungs. I am going to, for the purpose of the video, I'm not going to place my stethoscope underneath her shirt, but I would normally place it underneath the patient's gown. I will be listening each breath for the inspiration and expiration. You take a deep breath. Take a deep breath. Take a deep breath. Deep breath. And deep breath. Okay. Now I'm going to be listening to the lungs on the back side. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Have you been experiencing any coughing recently?
No.
Okay. Lung sounds are clear. Her respirations are even and unlabored, and her chest expansion is equal bilaterally. The next thing I'm going to do is, while doing that, I noted that her skin color is noted normal in color for ethnicity. It is warm and dry. And now I'm going to check her skin turgor. It is elastic. And now I'm going to check her cap refill. It is less than 2 seconds. Can you squeeze my fingers for me? Her hand grips are equal and strong. The next thing I'm going to have you do is hold your arms out and push them up to the ceiling while I lightly push down. Okay, good. And now push against my hands. Okay, good. The next thing I'm going to do is check your abdomen. I'm going to listen to the bowel sounds. I'm going to listen in all 4 quadrants for 5 seconds total each. Okay. Next, I am going to lightly push on your stomach. If you feel any discomfort or pain, please let me know. Okay, can you tell me when your last bowel movement was?
This morning.
Okay. Next, I am going to check your lower extremities. I'm going to lift the blanket up to maintain privacy. We're going to check the lower extremities. Make sure there's no open wounds, incisions, old surgical scars. I am going to remove your sock and check your cap refill on your toes. And it is less than 2 seconds. No abnormal skin coloration noted, no edema. We're going to check this one. Again, cap refill is brisk, no edema noted, no discoloration. I'm going to check your popliteal pulses and your pedal pulses. And they are all strong. Now we are going to do similar to what we did with your arms. I'm going to have you push your leg up towards the ceiling. Okay, and then perfect. Now this leg. Okay, perfect. And now we're going to do your toes. If you can bring your toes towards your chest. Perfect. And then push against my hands. Perfect. Tell me about your diet. Do you follow any strict diets?
No, I eat anything I want.
Okay, perfect. Do you take any supplements?
Mm-mm.
Okay. When you're walking, do you use any kind of walking device such as a cane?
Mm-mm.
Do you feel like you have good balance when you walk?
Mm-hmm.
Okay, good. When you use the bathroom, do you feel like, do you have any burning or pain
Mm-mm.
when you urinate?
Mm-mm.
Do you have any frequency or urgency?
No.
Okay. Do you feel like you empty your bladder
Mm-hmm.
when you void? Okay, perfect. This is the end of our head to toe for this patient. And now I'm going to discuss things that this patient doesn't have, but another patient may have, and what I would look for and document. If the patient was on a vent, I would check proper endotracheal tube placement, monitor or check the settings for the machine. I would clear any secretions and document the type of secretions that were found, such as color and thickness. I would monitor the patient's respiratory. If the patient had a chest tube, I would chart the type of drainage system, the location and size of the chest tube, and the amount of suction, and if there was any bubbling in the water seal chamber. I would chart that the drainage system is below the insertion site, and I would make sure and chart that the sterile dressing is clean and dry and intact, and if it wasn't, I would replace the dressing. If my patient was to have a Foley, I would document the size and type of catheter, the urine color, and if there was any odor noted. I would ensure that the Foley bag is secured and placed below the bladder and record strict I's and O's for the patient. If my patient had a GT tube, I would check placement, verification, the type of tube, the suction setting, any drainage, and any residual found. If the patient had vascular access, I would document the type, location, and size. I would look for and document any redness, swelling, or warmth to the area. I would ask the patient if they were experiencing any pain to the area of the access site. And then I would check and document if the fluids and or meds are the correct ones ordered and that they are running at the correct rate. If the patient had any drains, wounds, or incisions, I would check if there was drainage coming from the site, if there was swelling, redness, or pain at the site. If they had sutures or staples, I would count each suture or staple and document the number that they have. And again, I would also check to see if they had any drainage or redness or warmth or pain at the site. If the patient was in restraints, I would document the reason for the restraints that are needed. I would document if alternative methods were used before applying the restraints. I would document the type of restraints that are used and the number of restraints and location of the restraints. And then I would document and check the skin integrity underneath the restraints. And I would also check and document the circulation and if there's any swelling to the extremities below the restraint. If my patient had an order for a incentive spirometer, I would assist the patient at the times ordered using it and record the number that they reached and how the patient tolerated it. If my patient had CVP, PAP, or ICP or CPP, I would check and monitor the range and document their current range for those levels. This is the end of my comprehensive assessment. Thank you.